Thank you, Senator. I think we all recognize as you say, the sobering statistics, the sobering reality that far too many of our native people around the country face, whether Montana, New Mexico, Alaska. It is not acceptable. And I think your challenge directly to IHS that it is not acceptable and must be addressed is our challenge. You raised the issue of opioids and where does meth fit, and heroin is part of it, but we had a community, a very small community, ask our governor to declare a state of emergency to shut down a liquor store in an adjoining community because the village was dry. People were going into the larger community to get alcohol, and their resolution was pretty clear and pretty simple. Alcohol continues to kill us. So while there's a great deal of focus right now on opioid and the opioid response, we can't lose sight of all of the other scourges that we're dealing with. And in your recognition that the suicide rate amongst our young people is shocking, but it is tied to what we are seeing with the drugs, with the alcohol, the substance abuse. And so when we say $150 million, if the Department of Health and Social Services determines that they're going to shift this over here into the IHS account, to me that's not acceptable. I do think that there needs to be a more directed focus. In Alaska, I'm told that when it comes to suicide rates amongst young Alaska Native males, we're 10 times the national average. And we just kind of get to the point where it's like, oh, we throw around these statistics. We're 10 times the average, we're 4 times the national average, and it doesn't even become real because it's just so out of check, out of alignment, and yet we're not able to get our arms wrapped around it. And one of the challenges that we face when we think about suicide is the ability to provide behavioral health, mental health needs. We don't have it in our big communities, much less in our rural communities. This is something that I'm working with Senator Smith on the Indian Affairs Committee on behavioral health funding. We'd like to put it into the mandatory funding side of the ledger, just as the special diabetes program was on the special side of the ledger, because we feel we've got an obligation to address some of these problems, and when it's discretionary, it's just exactly that. It's discretionary. So I thank you for raising these critically important issues.
Madam Chair, thank you for your leadership and working with Ranking Member Udall. We must do better.
Yeah,
yeah,
we do.
Thank you.